Good afternoon, everyone. My name's Maria Harlan, and everybody can hear me in the back, okay? Okay. We're here to educate you on Medicare. What is Part A? What is Part B? What's Part C? What's Part D? What's Medicare Supplement? What's Medicare Advantage? When do I enroll? What's this penalty I'm hearing about? And how much do I have to pay if I enroll in Medicare? And then how does it coordinate when I retire from the college, and what benefits are available to me? And that's why you have a benefits team here that can help with that information. But today we're going to learn about Medicare. 10,000 people a day are turning 65 in the U.S. The baby boomers are here. We were born between 1946 and 1964. We have arrived. So 10,000 a day turning 65 in the U.S. Just imagine that. So in your presentation deck, you can follow along, and what I would like to do is have you hold off your questions until the end. Maybe just write your question on the slide that I'm presenting. I've been doing this over 10 years, and what I've found is that your questions are really going to be answered in the following slide afterwards. So let's get started. When you work for the college, you choose a health insurance plan to cover yourself and your spouse and your children, and then all of a sudden that word retirement comes around. And some of you may decide to retire under the age of 65. Some of you may decide to retire at age 65. Some of you may not want to retire until you're 70 or 80. How many are going to retire past 65? Oh, there you go, the whole room. No, I was kidding. So you have to understand, what do I do before I celebrate my 65th birthday? Because the word Medicare comes around, and you're getting a lot of mail at home. You're a commodity at age 65. Everybody wants your attention at age 65, other health insurance out there. But remember that you're through a group insurance, through the college, through CISC, and we just want to explain what Medicare is today to you. So what is Medicare? Medicare is our federally funded national insurance program that was established back in 1965 under President Lyndon Johnson. And Medicare is administered by CMS, the Centers for Medicare and Medicaid Services. And who were the first two people that received their Medicare card in the U.S.? Trivia. Anyone? No? Jack Benny. Nope, but President Truman and his wife Bess. So just in case you end up in jeopardy, that is the answer. And if you drive through Missouri, Independence, Missouri, the Truman Library, what a wonderful place to visit, and you'll see where Medicare was signed into law there. So who can join Medicare? Who's eligible? Most people will fall under the first bullet, which is people 65 or older, if you or your spouse are eligible for Social Security or have paid into Medicare taxes. So the magic number for Medicare in most cases is age 65, because we don't want to confuse you with, some of you may be receiving Social Security benefits at age 62, 67. This is Medicare. There are situations where you may be eligible through your spouse's Social Security number. There are situations where husband and wife, the wife might have stayed home all her life and did not work. She did not accumulate quarters in the system, and she can be eligible under her husband's Social Security number because he has 40 quarters, and we'll talk about the quarters here in a minute. But afterwards, again, we're here to help you with your personal situation, your personal questions that you don't want to ask over a big forum, and we can answer those for you. There's also people under the age of 65, and because of a disability, and after a 2-year waiting period and collecting Social Security disability, they too can be eligible for Medicare. And then there are those with diagnosed with end-stage renal disease or kidney failure at any age. They're eligible for Medicare. And also Lou Gehrig's disease, also known as amyotrophic lateral sclerosis, is eligible for Medicare. So Medicare has 4 parts. There's Part A, B, C, and D. Questions at the end, but...
Do you prefer me to hold questions for the end?
Yeah, that's what I mentioned earlier. Yes, that's okay. So Part A is the first part of the Medicare program. When you hear Part A, it's considered hospital insurance. It helps pay for your hospitalization, your skilled nursing, your hospice and home health care. Is there a cost for Part A? Do you have to pay for Part A? Well, it depends. As long as you have 40 quarters, that means there is no premium to you if you or your spouse have worked at least 10 years of Medicare-covered employment. 10 years equals 40 quarters. And we used to receive that Social Security statement in the mail, and inside cover it'll say you have enough quarters at age 65 to be eligible for Medicare. And they stopped mailing it, but somebody said they're sending it again. So if you're not sure about how many quarters you have, or you want to just find out, you can contact local Social Security office to figure out how many quarters you have in the system. Now, if you happen to have worked fewer than 10 years, let's say you're turning 65, and the Social Security rep says, hey, Maria, you only have 38 quarters in the system. You're short 2 quarters to get that premium-free Part A. I can either continue to work until I have 40 quarters in the system, or Medicare has a formula to determine how much you would have to pay for Part A. And right now, if you had less than 30 quarters, it's $422 a month for Part A alone. But you don't want to fall into that. I think most of you should fall under the no premium for Part A. I know in the old days there were certificated teachers that did not pay into Medicare, and in the late 80s they were asked to start paying in. So by now you should have enough quarters. If not, you can qualify again through your spouse, or if you have a personal situation you want to talk to me afterwards, we can do that. And then there's Part B under Medicare. We're on slide 6. If you hear Part B, that means it's the medical insurance, your doctor's visits, your labs, your radiology, your durable medical equipment, your dialysis, and some preventive care services. So Part A is hospitalization, Part B is medical. Anything that doesn't fall under hospital services falls under Part B medical. Unfortunately, there is a premium for Part B. It's not free. So how does the government determine how much I pay for Part B or how much Ron pays for Part B? They look at our income tax return 2 years prior to enrolling into Medicare. So for example, if I'm going to enroll in Medicare for the first time, this year is 2018, I'm turning 65, they're looking at my 2016 income tax return to determine how I filed my income tax. Did I file single and reporting below $85,000? Then my Part B premium is $134 a month. If my husband happens to be 65 and enrolling, he too has to pay $134 a month, because maybe we filed jointly and we reported less than $170,000 a year. This is based on your modified adjusted gross income as reported 2 years ago. Now, once you're enrolled in Part B and you're paying the minimum $134, now 2019 comes around, you'll get a letter around December telling you what your new Part B premium is going to be. Again, they do a 2-year look back. So in 2019, they're going to look at your 2017 income tax return to determine where you fall in terms of your Part B premium. So I was working with the retiree once, and she was paying the minimum. She's in her late 80s, and all of a sudden she's paying $428, and she's asked me, why did they start billing me a higher Part B premium? And I told her, remember, it's always a 2-year look back. What did you do 2 years ago with your income tax return? Did you file and you made above $160,000? She said, well, I sold the house and I made a lot of money. And that may have been what triggered her increase in her Part B premium. So for 1 year, she may be paying $428.60, and in the next year, they're going to look back 2 years to see if she's under the $85,000 and back to the minimum. So it's always between you and the federal government to determine if they have your Part B premium correct. If you disagree, you can go to them and say, how did you determine my Part B premium? And they'll tell you, because the IRS, the Social Security Office, CMS, and Medicare are all connected. They kind of know what's going on with your...
So look back on what's we're waiting.
Yeah, it's a look back. So if I enroll today in 2018, I'm 65, and they determine, well, you made above 85,000, Maria. Your first year of Part B premium is $187.50. So I'm in the system, I'm in the Medicare system, and the next year in 2019, they're looking to see how my 2017 income tax return was filed. And they say, well, you're not making as much, so depending on what the minimum is for each year is what I'm going to pay. Why I say that is because every year the government publicizes a Part B premium table around October, November of each year. This is 2018, so we're going to wait to see what 2019 looks like, 2020 for those of you that are maybe 2 or 3 years away from 65th birthday. And last year it was still 134. 2 years ago it was a minimum of 104.90. 3 years ago it was 96.40. So by the time I retire, who knows how much the minimum Part B premium is going to look like. Now there is a hold harmless provision in place. What that means is that, you know, there's a whole bunch of people that are already enrolled in Medicare today. And there's a hold harmless provision for them, meaning they don't want to raise their minimum Part B premium to 134 because the cost of living adjustment only went up a couple percentage. So they don't want to increase, like my mom and dad's premium, up to 134. So some folks may be paying less than 134 for their Part B. Some of you might have friends that retired earlier and you're going, why are you paying only 109 or 104? Well, I'm paying 134, again, because of that hold harmless provision in place. Now, this premium for Part B, for those of you that do collect Social Security benefits, it's usually deducted. That Part B premium is usually deducted from your Social Security check. It'll have a line item minus Part B premium, 134. But for those of you that may not be collecting Social Security benefits, you can ask that it be deducted from your checking account or your savings account, or you can ask Social Security to mail you a bill every 3 months, and quarterly you have to pay for your Part B that way. Now, there is what they call a late enrollment penalty. And let me demonstrate what that means. There is what they call enrollment periods into the Medicare program. And if you don't enroll within a certain time frame, the government puts a 10% late enrollment penalty on top of your Part B premium. So how many in the room are under 65 working? Over 65 working? Anybody retired in the room? One, okay. So what happens with the initial enrollment period, let's take Sam here, for example. He's turning 65, and he's retired. Some of you may decide to retire like at 60, 62, 63. So if you're an early retiree and you're about to celebrate your 65th birthday, you have what they call an initial enrollment period into the Medicare program, which is 3 months before your 65th birthday, up to 3 months after your 65th birthday. That is your 7-month window to enroll in Parts A and Part B by going down to Social Security office. Let's say you're paying $134 for Part B and premium free for Part A. Let's pretend Sam's birthday is in June, so he can enroll as early as March and as late as September to fall within that 7-month window because his birthday is in June. And if he goes to Europe and decides to have a vacation and comes back in October, he goes, well, gosh, I forgot to enroll in Medicare. Let me run down to Social Security office and enroll. The Social Security rep is going to say, sorry, Sam, but you missed your 7-month initial enrollment period. The only time you can enroll in Medicare again is through their general enrollment period, which is January through March of each year, and it won't be effective until July 1st of that year. And by the way, if 12 months went by, there is a 10% late enrollment penalty put on top of your $134, which is $13.40. It's 10% for every year, every 12-month period that you decline enrolling in Part B. So if Sam here is a retiree at 65 and he decides, oh, I don't need to enroll in Medicare, I'm not going to enroll, and then later on at 70, he's like, gosh, I better go down and enroll in Medicare. How many years have gone by? 5 years? That's a 50% penalty. And once you're assessed a late enrollment penalty into the Medicare program, it stays on record for life as long as you're enrolled in Medicare. It's not just like a one-time penalty. Whatever your Part B premium is and you're assessed a late enrollment penalty, it'll always be on top of your premium. Now, how many people are going to work past the age of 65? So what about the folks that are working past the age of 65? Let's say Sue here is turning 65, but she would like to keep working. And the important thing is there's a plus. Plus, she has group health insurance through the college. As long as the employer that you're working for has 20 or more employees, you can go down to Social Security office and say, hey, I'm still working and I'd like to work maybe another 3 years, for example. I'd like to defer my Part B until I decide to what? Retire. And then they say you have up to 8 months after your retirement date to enroll in Part B to avoid that late enrollment penalty. She can take Part A as long as it's free at age 65. It's just on record that you have it. But no need to pay for that Part B premium if you have group health insurance. Same thing if you're covering a spouse. What if Sue's covering a spouse and Sue's only 62, but the spouse is turning 65. She's still working for the college. Where are we, Marin?
Yep.
Does he need to enroll in Part B if she's covering the spouse under her group health insurance? The answer is no. No need to enroll in Part B yet. He can go down to Social Security and say, my wife is still working and she's covering me under her group health insurance, so don't enroll me in Part B until she decides to retire. And then they both have to go down at age 65 and over to enroll in Part B and pay that premium. So some of you may have dual coverage. You can talk to us later. What if my husband's working at this university and I'm over here and he has insurance and I have insurance? So each one of you have several different scenarios, and we can walk you through your personal scenario afterwards. So now that we've gone over A and B, we're halfway there. We're going to go over what C and D is. Let's pretend that we're all like Sam here. We're 65 plus. We're all retired now, enjoying our spouses at home. I was kidding. And we have enrolled in Medicare, A and B. We're paying the minimum, or let's just pretend it's $134 and it's $0 for Part A. By the way, the Medicare card is a red, white, and blue Medicare card, and some of you might have parents that have them. There's going to be a change coming up in April of 2018. Currently, your Social Security number would be on the Medicare card. In April, the government says no more Social Security numbers on Medicare cards. It's going to be an 11-digit Medicare beneficiary indicator number. So, and all existing 150 million Medicare beneficiaries will all receive new cards within the next 2 years. So some of your friends might say, you got a new card, why don't you have it? Just wait till the government releases it for you. So Sam here He's like, okay, I retired from the college. I'm 65 and over. I got my Medicare card. I'm done. He's not quite done yet. The government wants to know, well, Sam, how do you want to receive your Medicare benefits, your hospitalization, your medical insurance? And he's like, well, what do you mean? What are my options? Your first option is getting Medicare through what they call original Medicare. That means Sam can go to any doctor in the United States that accepts Medicare patients. You can go take your red, white, and blue card, go to Texas, Oklahoma, North Dakota, and say, hey, Dr. Jones, do you take Medicare patients? He goes, yes, come on in. You show the Medicare card, and if that's all you had in terms of insurance, you have deductibles and co-insurances that you pay first before Medicare kicks in. So let's pretend you're hospitalized and that's all you had was your Medicare card. You have like a $1,300 deductible before Medicare kicks in for the 60 days that you're in the hospital, the first 60 days. If you have to see a doctor, it's a $183 deductible and then 20% of the bill after that. So that's where you hear Medicare only pays 80%, you pay 20%. That's assuming that that's all you had in terms of your insurance. So a lot of people tend to purchase what they call a Medicare supplement plan, and they're also called Medigaps. And let's confuse Sam a little bit more. Those are plans A through N that he has to choose from. And don't worry, you'll get solicitation in the mail. You get things in the mail saying, sign up for our Medicare supplement plan, or you're watching TV and it's coming right you on TV, sign up for our Medicare supplement plan. And that's one way to receive your Medicare benefits. And just to note, for those of you that are on Kaiser, Kaiser Permanente does not offer Medicare supplement Medigap plans. So what's my other option? So Sam, you can assign your Medicare over to a private insurance company that offers HMOs, PPO plans, etc. And they're called Medicare Advantage plans. And that's what Part C of Medicare is all about. When a Medicare beneficiary decides to lock in their Medicare with a private insurance company, they're signing up for a Medicare Advantage plan. That means you're signing up for Part C. And Kaiser does have a Medicare Advantage plan, and ours is called Senior Advantage. Now, there's several Senior Advantage plans out there. There's a Senior Advantage individual plan. There's a Senior Advantage for CalPERS retirees, for federal retirees. You have your own exclusive Senior Advantage plan through CISC. And so Senior Advantage is available through CISC, through the college, Marin College. Or Senior Advantage could be available through an individual policy that's out in the general market. And there's several Senior Advantage plans out there. I'm just representing Kaiser. I can only speak about Kaiser. But you can hear, again, you'll get mail from other companies like, is there a scan up here, United Healthcare, Blue Cross, Blue Shield, and they'll try to solicit you to enroll in their individual Medicare Advantage plan. So you have to take which path, you can't be enrolled in a Medicare supplement plan and be enrolled in a Medicare Advantage plan. You have to make a choice. So that's what Part C of Medicare. So Part C, again, equals Medicare Advantage plans. All the services that original Medicare covers, we would cover under a Medicare Advantage plan. And usually, for those of you that are in Kaiser, that means you have to use a Kaiser doctor, the Kaiser network. And these are the different types of Medicare Advantage plans out there. HMOs, PPO, private fee-for-service plans. So many acronyms coming at you. So Now, when somebody assigns their Medicare over to a Medicare Advantage plan, that means the government pays us capitation to take care of Sam. We take on the risk for their hospitalization, their medical insurance, and then we're going to talk about Part D here in a minute. And there's usually another premium that's involved with the plan that you're going to enroll in. If you're going to find a Medicare supplement on your own, if you're going to get a Medicare Advantage plan to the college or get an individual plan, you get to figure out which way am I going to go once I retire at age 65 with my Medicare. Not only do you have to pay Part B, that's your first premium that you have to think about, but you also have to pay the premium of the plan that you decide to enroll in. And then there's Part D, the last part of Medicare. Can you imagine Medicare was signed into law in 1965, and only in 2006 did they add Part D under the Medicare program. And when you hear Part D, it's drugs, making sure that you have outpatient prescription drug coverage. But how do I enroll in Part D? Well, depending on how you use your Medicare upon retirement. Are you going to go on your own on the street plan and get a Medicare supplement plan? Then also get a Part D plan that's available out there. And that's through what they call a standalone prescription drug plan. That's all they offer is Part D plans. And you'll get to see those while you walk through Walgreens or CVS, or again, when you're getting mail at home, they're trying to tell you that they have a Part D prescription drug plan available. So if you decide to go this way, you have to carry your Part D card at all times, your Medicare supplement card, and your red, white, and blue Medicare card. Just like my father-in-law. He lives in Missouri, and he goes back and forth to Florida, and he wants to make sure he can go to any doctor that he pleases to go to, so he shows his Medicare supplement card, he shows his Medicare card, and his prescription drug card. Now, if you decide to sign up for a Medicare Advantage plan, such as Kaiser Permanente Senior Advantage Plan, we cover your A, B, and we automatically enroll you in a prescription drug plan. And once you're enrolled in a plan of your choice, there's no need to enroll in another Part D plan because it'll disenroll you completely from the plan that you're on. There are situations, I had a retiree once that the son was taking care of all of her personal bills, and he noticed there was a $14, prescription drug plan offer, and signed up her mother, and that disenrolled her from Kaiser. She was a Kaiser member for over 30 years, and she was wondering why she was no longer a Senior Advantage member, and we found out because she enrolled in another Part D plan. And if you don't enroll in Part D when you're first eligible, there's another 1% late enrollment penalty for Part D. Uh-oh, there's another table. So this slide here, remember that Part B as in Bravo determines, through your 2-year look back. And if you're reported making above $85,000, the government will also take an additional $13 from you. And this is paid directly to the federal government. Because wherever you file your income tax return with a 2-year look back, not only are they looking at what your Part B premium is going to look like. Let's say my husband and I reported that we made above $170,000. We both have to pay $187.50 for my Part B premium, for our Part B premium. And in addition to that, because we're above $170,000, the government says, because you're a higher income earner, we also need you to pay us another $13 times 2. And you have to pay this to the federal government, or else they'll disenroll you from the Medicare plan that you're on, because the government wants their money. And try not to, I know you're going to get a lot of mail at home. Try to sort out things that are coming from Social Security, from Medicare, from Marin College, CISC, and make sure that you read those important information. Even though you have the right to look at those other mail, just make sure that you don't throw away the wrong mail. So, you know, sometimes people are like, okay, I get this A, B, C, D, when do I enroll, and then what happens next? There's enrollment periods, again, when you enroll in a Medicare Advantage plan or a Medicare Supplement plan or Part D. But your initial enrollment is basically when you turn 65, the first thing you want to do is get your Medicare. That's the first thing. The second part is decide which way you want to go with your Medicare, and you have those initial enrollment periods again. You got to make sure it's like a parallel road. Not only am I working on getting my Medicare, but I'm also working with my benefits team at Marin College to determine what plans are available to me now at age 65 and fill out those forms that they require you to have. And then eventually, you know, that's like happening, this is probably happening 2 to 3 months before your 65th birthday. And then by that time, all the forms are in, you're enrolled in Medicare, and you're on the plan. Then you can retire and enjoy your travels. And then you have annual enrollment periods, right? Where some of you may decide, well, I don't like this plan, I want to switch to another plan under my college district. That's when you can change plans. From, is it Blue Shield here? Or Blue Shield to Kaiser, Kaiser to Blue Shields, so forth. And then you have what they call special enrollment. Some of you said, I'm going to keep working past the age of 65. So when you decide to retire at age 70, that's a special enrollment period where you're allowed to enroll in Medicare and the plan of your choice. Now, just make sure that some of you that are working past the age of 65, you have prescription drug benefits on your plans today, which is equivalent to Part D. So there's no need for you to enroll in Part D while you're still working past the age of 65. But those of you that are retiring, make sure that the plan of your choice includes Part D, or else the government's going to tack another 1% late enrollment penalty on you. Too many penalties. But then for those of you that, you know, sometimes situations happen, the spouse maybe passed away, you still need help paying for your prescription drugs. The government has what they call a low-income subsidy program that you can apply for. That's going back to Social Security. So as long as you can show that you have limited income and resources, you may qualify for a low-income subsidy. Now, when the Affordable Care Act was signed into law years ago, remember that when Sam assigns his Medicare to Kaiser and we're a Medicare Advantage plan, they reduced the way we were getting capitated to take care of Sam, the subsidy that was given to us by the federal government. Now what they're doing is they're auditing all Medicare Advantage plans in the country based on the quality of care that's provided to Sam. And with that quality care, there's a lot of different categories that we have to pass every year. Are you providing the preventive services to Sam the way you're supposed to? How are you managing his chronic illnesses? Are you prescribing the right prescription drugs? How fast are you answering his call when he calls your company? And then they survey our members, and they rate us based on that audit. And now, this is just to show you that Kaiser has a 5-star rating plan in the whole state of California. We're the highest rated plan 8 years in a row here in the state of California. And we are also located in all these other states. Should you relocate, we have individual plans that are available in the other states of Colorado, Georgia, Hawaii, and so forth. So when you do get a lot of things in the mail and you're considering a Medicare Advantage plan here or a Medicare Advantage plan there, you have the right to ask what their quality rating is moving forward. So let's stop there and open it up for questions about Medicare, A, B, C, D, the enrollment, the penalty, the premiums. Any questions on that? Yes?
Taking the example you gave of your father-in-law or something that lived in Missouri, if you move to a so you do have Kaiser Advantage and you move to a non-Kaiser state, what do you have to do then? Does Kaiser automatically give you an option of become an insurance company, or do you have to go on your own and find a...
So the question is, if I'm on Kaiser today, I live in California, but then I decide to relocate to Texas where Kaiser's not in there. What's available through CISC right now is Kaiser and is it the companion Blue Shield only. So they're only a state contract. So what you would do is tell your benefits folks that you're relocating, you have to drop the plan that's available to you, or whatever plan you're enrolled in California. 2 or 3 months before you move, you want to research what's available in that state that you're moving in and find out if there's a Medicare Advantage plan in that state. Doesn't have to be Kaiser. If Kaiser's not there anymore, it could be Blue Cross, United, you know, all the other plans that are out there. Or you can get a Medicare supplement in the state that you're moving into. But if you're traveling versus relocating, you're covered worldwide for any emergency or urgent care as a Kaiser member.
So Maria, in that case where he moves from a Kaiser state to a non-Kaiser state, the other thing he would need to do is, as he's enrolling in the other plan, part of that process would be to unassign his Medicare to Kaiser, correct?
Yeah, that's why when they drop the plans, that's going to be unassigning. That means you no longer have your Medicare assigned to Kaiser. It's loose, and you decide where you want to go with your Medicare now.
But you still have the Medicare card.
Yes, you still have your Medicare card.
You still use the conventional Medicare, correct?
Yes, you can still use this, but make sure that you're ready to pay these, or you get a Medicare supplement plan. Correct. Yes?
I plan to enroll in Medicare through Kaiser. Is there a way to assure that I end up with a plan that's similar to what I've gotten used to here at our wonderful Kaiser plan through the College of Marin?
Well, that's what we're going to transition to. Let's do that real quick.
And that's fine if it's in later.
No, this is a good transition. This is your Senior Advantage plan available through Marin College right now. It's called the Senior Advantage plan under CISC, the Self-Insured Schools of California that administers your retirement benefits too. And it's called a $10 plan, meaning when you have to go see a doctor, it's $10 copay. And there is no lifetime maximum, meaning no matter if you're in the hospital and going through so much that Kaiser's not going to stop paying just because you're in there for so long, but there is no lifetime maximum. If you have to see a specialist, it's $10. If you have to have labs or x-rays done, it's at no charge no matter how many times they want blood from you. You have a little surgery coming up, it's a $10 procedure. If you have to be hospitalized, no matter how many days you're in the hospital, it's at no charge under this plan. In emergency room visits, you have to pay a $50 copay unless you're admitted. Sometimes the copay is waived there. And that ambulance trip is $50 per trip. And here's your prescription Part D plan. Remember, A, hospital, B, medical. And then Part D is your prescription drug plan. If you happen to be taking any generic drugs, it's $10 for a 100-day supply. If you're taking any brand name drugs, it's $20 for a 100-day supply. It's a nice, rich plan there.
And I was just going to point out that your benefit as an active employee of Marin is slightly different than the Medicare version. So you'll notice like the office visits are $10 versus today you have $20. You'll see the emergency and ambulance are $50 versus you have $100 on emergency. prescriptions are essentially the same. You don't currently have an eyewear allowance, and you don't currently have the Silver and Fit benefit. I just wanted to call that out.
Would this still be available to someone who hadn't worked at college, Marin? I'm just wondering because it seems like I'm a part-timer and I don't have any guaranteed medical benefits when I retire.
So in order to have eligibility to enroll in the plan, you have to be a qualified retiree of the district, of the college district. And I would have to defer to Ron. You know, there are so many different circumstances. You know, some folks are full-time, some folks are adjunct, and they're not enrolled in benefits. If you haven't been enrolled in the benefits, you don't have an opportunity to enroll in the benefits at retirement. So there would be, you know, individual conversations that probably would need to be had to answer a lot of specific scenarios you may have.
Yes, ma'am.
If you are a member of the district, this is the same for your spouse as well?
Yes, if your spouse is 65 and over and has Medicare, you can also enroll your spouse in the plan. Now, another benefit for this plan here is called Silver and Fit. So for the first time, we were hearing from the retirees that I go to the gym, is there a gym membership available? And there is now what we call a Silver and Fit program. Once you're enrolled in this Senior Advantage plan, you become a member of Silver and Fit. And you have to register online as a Senior Advantage member. And what happens is you get to choose the different types of facilities. Some of you may want to go to a gym that has spa or a swimming pool, or some of you would like a basic facility. Some of you may want to work out with just all women in there, like curves, or you want to go to an exercise center down the street that does Tai Chi at the park. So you put your zip code on the right. Can you give me a zip code here?
94904.
9?
4.
That one?
I don't think it's there's nothing else.
Oh, 94904.
Correct.
Hey, that's pretty good. And what happens is it tells you that curves and 24-hour fitness is within a mile radius, or if you want to go beyond a mile. Let's say you're interested in a 24-hour fitness, so you register online, and you get to print out your gym membership card, and then you go to 24-hour fitness. You no longer have to pay that $30 gym membership.
So you're automatically enrolled at that point?
Well, you register first. Pick a gym that you would like to be affiliated with. And some of you may have a gym now, and then you go here and you go, wait a second, my gym's not up there. You can nominate your gym by calling Silver and Fit and say, hey, Joe's gym down the street is not on your Silver and Fit registry. Can you please add him on? And it takes maybe a month to get him in the system. So that's something that's also available with this plan. Now, for those of you that don't like going to the gym, Silver and Fit will also allow you to have 2 DVD workouts mailed to your home. So if you want a boxing on the chair, or, you know, you can do stress management, Tai Chi on the chair, they will send those DVDs to you 2 a year. I know, I need to start working out again. I'm just kidding. So these are the phone numbers that are available. Social Security, have that available in your pocket. Have your Medicare number, just in case you want further questions about Medicare and your quarters. And it's always good to have if you have children, you always have that favorite child or two. Make sure they have a list of your prescription drugs that you're taking. Make sure they have a copy of your Medicare card and your health insurance card and your prescription drug card, whatever you have as your coverage. Because when an emergency happens and you're not able to tell the ambulance or whoever what insurance coverage you have, you want to make sure your daughter or your son knows what cards to show the ER or the emergency room. Especially Kaiser members, you put your red, white, and blue card away. Once you're in Senior Advantage, you now just use your Kaiser card no matter where you go. Because showing the Medicare card, that means they think all you have is Medicare, and then all of a sudden all these claims go through, and you just want to make sure that your loved ones know, especially the prescription drugs, because I had to take care of my parents, and I always had it in the back pocket, and the doctor's like, wow, you know all what the drugs your parents are taking? I'm like, yes, I don't want to make sure you guys are talking to each other, because it's very critical.
If several years go by before my wife is 65, if I'm eligible for the Kaiser plan now, could she still, like, say 5, 7 years go by, I can still go through the Kaiser plan that I had here?
Right, it's a combination. It's called a,
So as long as you've had continuous enrollment through the CISC plan, you can add your wife at a future open enrollment if she's not already on, contingent on you being a current enrollee, or you can, maintain enrollment if your wife wants to enroll along with you.
Thank you.
No breaks in coverage allowed, and once you separate from service, retire, you can't come back at a future date. Can't come back to the plan. You don't have a future enrollment opportunity. If you do not enroll at the time of retirement, you cannot come back to the plan at a future date.
so if I retire at 65 and I can enroll in that Senior Advantage plan, and I say, no, thank you, I'm going to go on my own and be on the individual market, you can never go back to it.
But once I do, my wife's always
Still,
able to
as a dependent.
As long as you've maintained continuous enrollment.
So that means if I enroll in this program and then go to Arizona and say in 4 years I decide to move to Arizona, I live there for a year and decide it's too hot. I go back to California, I can't re-enroll.
So you would have one option in that scenario, but it's an expensive option. So currently, the only options that are available through Marin Community College post-65 retirees is the Kaiser Senior Advantage and the Blue Shield PPO. So in order to have the right to change a plan in the future would be continuous enrollment. So you'd have to enroll in the Blue Shield PPO. At this time, the rates for the Blue Shield PPO post-65, I think are about $560 to $650 per month per person, depending on the plan that you select. There's an 80% and a 100% option. They're pretty expensive, and of course, that's on top of your Part B premiums. So it's not an option that a lot of folks will consider, but it is something to think about.
How much is it?
Somewhere in the neighborhood of $560 to $650, depending on which plan they select.
And how much is a Senior Advantage plan?
Senior Advantage plan that is offered through CISC is currently $343 per month. $343 per month, and those rates are good through September 30th, 2018.
That's the one.
Yes, that's the plan up there. So the other thing, and Maria, you were going to touch on it, but just keep in mind that Kaiser Senior Advantage, it sounds like Kaiser Senior Advantage would be the same. If your friend has Kaiser Senior Advantage or you have Kaiser Senior Advantage, it sounds like it would be the same. There's a very significant difference between the group plan that is available to retirees and what you would purchase as an individual. Very significant benefit differences. And those specifically have to do with the co-pays, the out-of-pocket, the hospital cost shares, and really, I think the most profound is the prescription drug benefit.
So what Lola's saying is that you don't have to stay with the college plans that are rich benefits, Cadillac plan. You can go on the individual market. This is just an example of what's available out there in the individual market from Kaiser, because I'm a Kaiser rep. But Blue Shield has an individual Medicare Advantage plan, Blue Cross, everybody else, but I can only show you what Kaiser has to show for today. This is the individual Senior Advantage plan through Marin County, and the premium is $106 versus $343. So you're wondering, well, I'm just going to go with the $106, but what Lola's saying is just make sure that you're aware that your out-of-pocket may be more. So if you have to see a doctor, $10 on the Marin side, it's $35 on the street side. What if I have to be hospitalized? You have to pay $285 per day for up to 7 days before Kaiser kicks in. Well, what if I have skilled nursing? It's no charge under Marin, but up to 20 days it's no charge, but after that you pay $100 per day if you have to have rehab done. And x-rays is $35 per lab versus no charge on the Marin side. And the biggest one is the prescription drugs. This is what they call the donut hole. Let me try to explain that. So you can pay as little as $6 if you're taking generic drugs for 30-day supply, or if you start to take any brand or specialty drugs because of your, a chronic illness, you may have to pay more every 30 days. The minute that your out-of-pocket drug cost reaches $3,750, that means your co-pays plus the actual drug reaches $3,750, you enter the gap, the donut hole. And what it means is you may have to pay 35% of the actual drug costs when you're in this gap. And then once you're out of the gap, you go back to the co-pays. And in the old days, this used to be 100% of the drug. And when Affordable Care Act came into place, they reduced it to 50%, now it's 35%. I think eventually they're planning to get rid of this donut hole in the future, but we'll wait to see what the new administration has to say in terms of Medicare, but it doesn't look like they're going to touch that. So any other questions? Yes, ma'am.
Two questions. Where could I see that information that you were just displaying?
Okay, her question is, what if I'm interested in that $106 plan? You just go to kp.org, kp.org website, and just click on Medicare. It's going to say shop plans, Medicare plans, and then pick the county that you live in. And then it'll have this information. You can just take this phone number down if you'd like, the 1-877-852-5081.
And one last question.
Let me just finish with her for a second. Or you can have somebody come to your home with this plan to explain it to you, or you can attend a seminar from Kaiser that explains this individual plan.
What about dental?
What about dental? What about dental? Do you guys offer dental benefits?
We don't currently.
Now, this individual plan from Kaiser does have what they call Advantage Plus. For $20 a month, you will get dental, hearing, and Silver and Fit and Extra Vision.
You have to be enrolled in that
Senior Advantage Plan, yes.
Senior Advantage plan. So you couldn't get that dental benefit with the Part C?
Under Marin, right now, there is no dental benefits at this time.
Can't buy them like that.
At this time, that's not available.
Yes, sir.
So I just wonder, is there a way to ensure that I do enroll through the College of Marin plan so that I don't make a mistake and just go call up Kaiser and say, I want to do this?
Well, that's why you have CISC.
I did make that call already, and they just said call back in August, and
Yeah.
I don't know how it all happened.
Yeah, and I think that's a good segue to, I brought a copy of a sample letter that we send each and every member who is aging up to 65, whether you're active, whether you're retired, whether you're the subscriber, also known as the employee, or a dependent. And it gives the scenario. What if you're the actively working post-65? What if you're the spouse of an actively working post-65? It goes through the scenarios and it tells you what you should do with respect to Medicare A and B enrollment. But and additionally, it talks about if you're retired, you want to have at least we would always recommend 3 months of lead time of planning. So when you get ready to retire, that's when you need to check in with Social Security, make sure that you are enrolled in Part B if you deferred Part B, enroll in Part A if you didn't enroll in your first opportunity. Talk to Ron, schedule an appointment with Ron in advance so you can look in your situation is a very common situation, and it comes up a lot where perhaps the eligible retiree is aging up before their dependent is. And what do we do with the dependent coverage? Well, in order to maintain the coverage that they currently have, which is more than likely, of course you can price check me, more than likely going to be less expensive than what is on the open market. On our Medicare plans, they're more expensive than what is on the open market, but that's because the benefits are richer. But when you're under 65, it's just that the rates for under 65, that age band between 60 and 65 is a pretty expensive rate for in the individual market. So if you were to go and look at purchasing coverage for your wife, that would be the question: is evaluating, okay, what if I go on my own and what if she goes on her own? Let's look at how much that would cost and what the benefits are, and let's compare that to how much it costs for us both to stay on the Marin Community College benefit post-retirement.
There's a way I can retire as a part-timer and still have her covered? I don't think there is.
And I kind of tend to speak in general terms, and I forget that my audience includes both full-time and adjunct, and there's a lot of different complexities.
Let's talk later. Yeah.
I think there's a question. Did you have a question? You did? No? Okay. Yes, ma'am.
If you have benefits through the college to age 70, is there anything else that you need to be considering?
So I think that you're talking about that you were hired before a certain date and you were eligible for a district contribution towards the cost of your health benefits. There are different lines in the sand, and some people fall behind that line. Again, it's an individual discussion with Ron. But the other thing is you need to plan for what happens after 70.
Right.
And again, still with the lead time.
But also plan when you turn 65 to get Medicare. Even though you have district paid benefits till 70, you have to have Medicare A and B at 65.
What about the prescription? We understand that would be the same situation.
Do you think you'll be retired at 65?
Hope so.
And then so you get your A and B and then decide which plan do you want, the Blue Shield PPO or the Kaiser. And if you want the Kaiser, it includes Part D. It's automatically in there. Yeah.
Regardless, you would get it.
Yeah. Any other questions? Was this helpful? The test will be emailed later? No, okay. So thank you. Oh, well, Ron's going to go over your website at College of Marin.
I just want to point out, we have a new website now. If you go to the benefits page and scroll down to retirement, all these resources are now available on the webpage. So there's Medicare resources, Social Security, CalSTRS, CalPERS. This presentation will be posted by next week. If you want to go back and look at it again. The PowerPoint's on here. Lots of different resources for those different retirement scenarios. So afterwards, if you have specific questions about Medicare, Maria or Angela, she's still here, will be able to answer
She had to
them.
leave.
If you have questions about your current benefits, Lola, Susan, or I can answer those.
Thank you so much.
Contact me later on. Thank you very much.
Thank you.